What is localized lymphoma and how is it staged? Imagine a cancer that stays put in one small area of your body, not spreading far or wide. That's what localized lymphoma is. It means the cancer is confined to a single group of lymph nodes or sometimes an organ outside the lymphatic system. This type of lymphoma is usually caught early because it hasn't spread to other parts of the body yet. Because of this, the outlook tends to be better compared to more advanced stages. To understand how doctors figure out how far the lymphoma has spread, they use a process called staging. The most common system for staging non-Hodgkin lymphoma is called the Ann Arbor system. It divides the disease into four main stages based on where the cancer is located and how much it has spread. Stage 1 means the lymphoma is limited to one lymph node region or a single organ outside the lymphatic system. This is considered early-stage disease. Stage 2 involves two or more lymph node areas on the same side of the diaphragm, which is the muscle that separates the chest from the abdomen. It can also mean one organ and nearby lymph nodes on the same side of the diaphragm. Stage 3 indicates the lymphoma has spread to lymph nodes on both sides of the diaphragm or involves one organ and lymph nodes on both sides, possibly including the spleen. Stage 4 is the most advanced, where the lymphoma has spread outside the lymphatic system to organs like the liver, bone marrow, or lungs, and may involve distant lymph nodes. Doctors also use letters to give more details. For example, a letter A means there are no symptoms like fever, night sweats, or weight loss. B indicates these symptoms are present. The letter E is used if the lymphoma involves an organ outside the lymphatic system, and S if the spleen is involved. Determining the stage involves several tests, including imaging scans like CORT, PET, or MRI, blood tests, and sometimes a bone marrow biopsy. These tests help locate affected lymph nodes or organs and see whether the disease is localized or spread out. If the lymphoma is localized, meaning stage 1 or 2, treatment options often include radiation therapy, sometimes combined with chemotherapy. The exact approach depends on the type of lymphoma and individual factors. Knowing the stage helps doctors plan the best treatment and gives patients an idea of what to expect. Early-stage lymphoma generally has a better chance of successful treatment and long-term remission compared to more advanced stages. Remember, each person's situation is unique, so it's essential to work closely with healthcare professionals to understand your specific diagnosis and treatment options.